Did you know taking a vitamin D supplement can actually land you in hospital? My name's Dr. Mohammed. I practice in London in the UK, and the reason I say that is because I've never actually seen any of my colleagues check for this once they've prescribed vitamin D to any of their patients. So, vitamin D definitely has its place. With my interest being in skin and hair, we know it's really important for your hair growth, the pigment of your hair, because deficiencies can lead to premature graying of the hair. We also know it's important as far as skin aging is concerned. It's got photoprotective effects on your skin. Also, a low vitamin D level is associated with psoriasis. So here's where it gets interesting, right? If your vitamin D is in its boots, usually in the UK a level less than 30, you need to have a loading dose of 300,000 units, and this is usually spread across a 6 week period. So we will give you 50,000 units to take every week for 6 weeks. Now, what I haven't seen any doctor do is at the 4 week mark, you need to do a blood test. No, you're not checking the vitamin D, you're checking the serum calcium. The reason for this is because high doses of vitamin D causes you to excrete more calcium in your urine. Now, why is this a problem, I hear you ask? If you're prone to developing kidney stones, this is a risk factor for developing a kidney stone, and if any of you have had a kidney stone, it can put a grown man down. I've seen lots of patients in the emergency department who have needed, during my training, who have needed to have Oromorphin, strong painkillers when they've got a kidney stone. So the takeaway message is, if you're on a high loading dose of vitamin D prescribed by your doctor, make sure you have a blood test to check the serum calcium at the 4 week mark, because if it's high, then we might need to adjust your vitamin D dose to reduce your risk of kidney stones and complications from that.